IV push drug administration. IV push drugs are administered directly into the vein, and this can be done with a safety needle connected to a syringe that contains the drug that is then connected to your IV site, or with a winged infusion set that is connected to a syringe that contains the drug. Principles of direct injection of IV drug is you always want to check the drug against the physician's order, making sure that you have the correct drug, the correct form of the drug, and the correct dosage. Confirm patient identification, and as I've said before, always wash your hands with IV therapy. Wear protective gloves. Select the largest suitable vein if you do not already have IV access. Remember that the drug is immediately diluted with blood, so this will minimize the irritation of the vein wall and decreases the likelihood of venous spasms. Always cleanse the injection site with antiseptic for at least 30 seconds. You'll cleanse the skin if you still need to perform a venipuncture, or the Y injection port of a primary IV administration set, or the injection port of an intermittent infusion device. Make sure that you allow that antiseptic agent to dry naturally, and if you inject into a Y injection port of an IV administration set, always use the port that is closest to the patient, in other words, the one closest to the venipuncture site. If you inject into a primary line, make sure that you determine the compatibility of the drug to the fluid that you have infusing. If it is incompatible, you will clamp off the primary infusion, flush the line with normal saline, administer the drug, flush the line with normal saline, and then reestablish your infusion. If you're injecting into a heparin-locked intermittent infusion device, again, determine compatibility of the drug to the heparin flush solution. If it is incompatible, you'll follow the same step. You'll flush the intermittent infusion device with normal saline, administer the drug, and then flush it again with normal saline. And then you'll have to inject the heparin flush solution into the device to lock it once more.